you, Riddhi, for the introduction. Good evening, everyone. My name is Abhishree, and I'm going to begin today's session. Good to see that there are so many people here who really care about their eyes. And in today's day and age, we actually spend most of our time in front of the screens, whether it's work, whether it's pleasure, whether it's just watching a movie, whether it's watching videos, YouTube, whatever it is. We mostly spend all our time in front of the screens. And how to tackle it, how to deal with it, how to protect our eyesight, how to stop our eyes from eye strain is what I'm going to talk to you about today. So yes, do ask me if you have any questions, and if I miss out on them while giving my presentation, I will definitely answer them towards the end of the session. I will just share the screen. Okay, so Sanjeevan for Perfect Eyesight is basically a one-of-a-kind clinic where I practice. I've been practicing there for the last 10 years. And here we treat all types of eye problems, starting with, like getting rid of glasses or getting rid of a high number, to serious problems that can also lead to blindness in the future or genetic eye disorders. So I'm very proud to be associated with this kind of an integrative medical setup where eye problems are treated naturally without any kind of invasive procedures or any kind of surgery. Before I begin, I would like to do a small kind of an activity. So I would request everyone to close their eyes. It's not a meditation, but it's just something that I would request you to do. Close your eyes and just follow whatever I tell you to do. Keeping your eyes closed, I would like you to imagine a day without eyesight. Imagine a normal, regular day, when you have to go to work and you are getting out of bed in the morning. As soon as you open your eyes, you cannot see anything. It's a day in complete darkness without your eyesight, without seeing anything, without being able to see anything. Just imagine. Imagine doing your morning chores, brushing your teeth, taking a bath, picking out your clothes from the cupboard, getting ready for work, or if you're working from home, bringing out your laptop or your computer, making your breakfast or tea, coffee. Basically just doing everything that you do on a regular day, but without your eyesight. If you have to travel or commute to your workplace, traveling whether in your private vehicle or public transport, reaching your workplace, settling down, getting ready to start your day, starting your work, taking calls on your phone, messaging people, replying to emails, whatever your work pattern or structure is, doing all of it without your eyesight. Having lunch, if you're ordering for food from some restaurant, everything basically, just a regular day that you normally have. In the evening, getting done with work, coming back home, cooking dinner, doing everything, meeting your family, meeting your friends, and going back to bed. Imagine all of it without your eyesight. You may open your eyes now. Can someone just tell me how, any one of you, if you can just unmute yourself and tell me how you felt? So anyone?
It's very difficult to even imagine life without your eyes. I think
Yes.
David here and people are writing in the chat.
Okay, yeah. Yes, okay. Felt really scared. It felt life would be so difficult. Yes, so basically the main reason is not to scare you when I do this exercise. It's just to make you realize how important our eyes are, and without our eyes we will not be able to function. We cannot perceive things without our eyes. It's such an important part of our body, and we will not be able to do anything. We are like totally helpless without our eyesight, and we don't have a choice but to believe that. Okay. So going ahead, I'm just going to explain you how our eyes work. It's a very, very basic, simple diagram here. I hope everyone can see it. Basically, whenever you see something, your eyes and your brain, they work in sync with each other. They are not two separate organs. They are interconnected to each other. So when your eyes are working, your brain is working at the same time, and vice versa. Okay. So when you see a tree, for example, okay, there is this layer in the back of your eye, which is called as retina. Okay. So the light intersects here, and inverted image is formed over here. Okay, every object, every little thing that you see, this process happens. Okay, in 1 second, no matter how many objects you see, that's what is happening in the back of your eye, which is called as the retina. From the retina, through your optic nerve, an image is formed in the brain, and the image becomes normal. The inverted thing becomes straight, and then you come to know, your brain comes to know, okay, now yes, I'm looking at a tree. Okay, so this process happens every second, every millisecond of your day. Okay, everything that you see, this is why you're able to see it. Okay, this is just for your general knowledge. Most of us probably know this process, most of us may not know it, but it's just so that we are aware of how our eyes actually work. Okay, I'm not going to get too technical. Basically, there are millions of cells that are present in our eyes, and each of those cells have particular functions, and how we see and how we basically behave with our eyes, how we treat our eyes, that's exactly how our eyes will work. Okay, your eye, just like any other part of the body, does not require to be sedentary. It cannot be like, for example, you cannot, when you sit in one place, you start facing all kinds of problems, this pain, back pain, knee pain, joint pain. That's what happens. Similar concept is applied for your eyes. If you are staring at a particular object for too long, all the muscles, all the cells start getting strained. Okay, so in order for your cells to function properly, it's very important that your eyeball is flexible and you're providing enough nutrition to your eyes to function properly. Okay, so there are many parts in your eye: the lens, the pupil, the cornea, the sclera, the optic disc. Like, these are just a few. There are millions of cells present in your eyes, which every day function thoroughly so that you can see clearly. Okay. Coming to vision impairment, I'm sure that there are, out of the 61 people that are attending here, somebody or the other face some or the other kind of eye-related problem on day-to-day basis, mainly because of our visual habits, or you can call it spending too much time in front of the screen. Probably if you don't face it, somebody in your family might have a problem related to your eyes, your children, anybody, your parents, your relatives. Something or the other. There are 1.3 billion people who live with some or the other kind of vision impairment globally, whether it is just wearing glasses for a small number, or to a serious genetic eye condition, or to a serious problem like glaucoma or cataract, etc. Okay, so why are there so many eye problems, like prevalent in this world? There must be some reason. There must be something that we're not doing right. That's why there are so many people getting eye problems, especially in today's day and age, the digital age. So 60 million people out of these 1.3 billion people suffer with only computer-related eye problems. Okay, this is something that has been created by us because of the digital day and age. So when you spend 6 to 7 hours in front of the computer screen, your eyes tend to be at work constantly. You're not giving your eyes the break that they deserve, even in the middle. If you're taking a break, you take a break on your phone. If you're not taking a break on your phone, you're working on your laptop. Or if you're not doing that, you're watching something on the TV. So your eyes, let's face it, are constantly at work. So that is the reason why many people face certain symptoms like headaches, eye strain, watery eyes, red eyes, itchy eyes, you feel like rubbing your eyes, feel dry eyes. So these symptoms have become very common as we progress with digital devices and things like that. So this should not be the case, because honestly, our eyes have been the same. No matter how much technologically we've become advanced, our eyes remain the same. The functioning of our eyes, of our body, has not changed. And that will not change. That's going to remain the same. But how we adapt to it and how we make sure that irrespective of what comes in our way, when it comes when our eyes actually has to work, we cannot let it strain. So that's where we have control in. So there are 60 million CVS cases globally. Now, CVS is computer vision syndrome. Can anybody just tell me in the chat what computer vision syndrome, or have you heard of this terminology, or is there anything that strikes you when you hear the word computer vision syndrome? Okay, Vartika is like, it might be related to eye problems due to prolonged screen time. That's right. Eye strain when you stare at the screen for long. Correct. So computer vision syndrome is something that where people sit for at least a minimum of 6 to 7 hours, spend that much time in front of the computer screen. They tend to face certain symptoms, and these symptoms are very, very commonly seen in these people, and that is why this terminology has come up, that is called as computer vision syndrome. Okay, so these are just stock images that I've used where you are sometimes too close to the screen because you're not able to see it clearly. It's a little blurry for you. Sometimes you're getting headache, especially in this part of your head. Sometimes you are just not able to concentrate. You're reading, but you cannot focus. It's totally out of focus. You have to take a break to come back and focus on work. So these are the little symptoms that people face. And I have done a little bit of research where we have noticed that all these problems that people face during computer work are all interconnected. So back pain, blurry vision, itchy eyes, irritation of eyes, neck and shoulder pain, headaches, eye strain, general fatigue in the body, and eye fatigue, they are all connected to each other. Okay, so if you have a back pain, it could be because you are feeling something weird in your head also. It could be because you're not sitting correctly and working. It could be because of your posture. So it's all interconnected in some or the other form. Okay, and most of our work is promoting sedentary lifestyle. Obviously, we cannot run, we cannot jog and work. We can't do that on the laptop. Okay, we have to sit in one place and do it. But there are certain ways and certain tricks that we can use where you are not, like stopping or basically obstructing your blood circulation, or you're not, sitting in a weird posture, or sitting like, lying down and working in some weird posture where you're not able to basically give your body the relaxation that it deserves. Okay, so these are just a few common symptoms that I have noted down, which I have commonly noticed in people and we have commonly seen at our eye center here in Bombay. Number one is eye strain. Number two is photosensitivity. Because we are always indoors and our offices are indoors and mostly air conditioned, we are not used to direct sunlight. That is the reason why most of the people we have seen their vitamin D is low, and vitamin D is the most underrated multivitamin or vitamin that we have seen. People don't really care about it. People complain of joint pains, shoulder pains, neck pains, but calcium deficiency. So all these things are connected to vitamin D. So make sure that your vitamin D is between the range, and if it's not, you must take supplements for it. So photosensitivity comes with lack of vitamin D in the body, where you're not able to take the sunlight. Your eyes cannot accept the sun that's coming. That's the natural light I'm talking about, because we're always indoors. Even if you have kids, promote your children to, I would say, play sports or play any kind of outdoor activity where they are getting direct sunlight, and then they're not just sitting indoors or on their tablets or on their gaming system. Red eyes is again due to too much eye strain that people can face, or because of rubbing your eyes too much, you can get red eyes. So with what happens is, when you rub your eyes, obviously your hand is not sanitized at all times. So when you rub your eyes, there's some or the other kind of infection that your eye catches, because your cells are very, very delicate. Your eye is the most delicate organ in your body. So immediately you can catch any kind of infection, because of which people could probably get a stye or something also. Then some people happen to see these floaters, mostly middle-aged people. They tend to see floaters in the day. That is also because connected to all the symptoms that I mentioned earlier. Vision loss is something that people notice who have genetic eye problems. I will talk about genetic eye problems in the future, like in my next few slides. Double vision also. So when you try and focus something very closely, or from very far off, you tend to get double vision. Or when you're reading something and you lose focus, you tend to see double vision, which is also very very strong symptom that we have seen in people. Rubbing eyes is could be because of dry eyes also, where you are continuously rubbing your eyes because you are feeling very grainy. And this mostly I have seen people get this post LASIK surgery when their eyes tend to get dry very often. Headaches is the most common symptom that we've seen. It could be due to lack of sleep, it could be stress, it could be tension, plus you're spending your time in front of the screen, so it all comes together and you start getting headaches. Thus, constant strings of mucus in eye is also a symptom of computer vision syndrome. See, it could be connected to dry eyes. Okay, so if you have this particular problem, I will give you a solution for this. Make sure that you're washing your eyes at least 3 to 4 times a day. Okay, so when you wash your eyes get instant oxygenation. Okay, because obviously your eyes need oxygen to work. So it's very, very important that you're washing your eyes just how you wash your body. Your eyes are left aside, you don't tend to take care of them. So when you are at work also, just go to the wash basin and you just have to basically make sure you're blinking your eyes like 6 to 7 times minimum, both eyes, in fresh water. And I'm sure this problem of yours will go. Is computer eyewear helpful to reduce CVS? See, computer eyewear that we have noticed is just a marketing thing. Honestly, there is nothing except for your vision habits that can help you when you're sitting in front of the computer. These are just ways of marketing this to people where you can probably just buy this computer aid, buy these glasses, Blu-ray protection. All this is just a marketing thing, I think, and that's what we have seen in our center also. And it is honestly not that protective. Obviously, if there is direct sun that's coming onto you and you're wearing sunglasses, that's a different thing. But you can adjust the screen brightness on your computer. So, that's totally fine. You can adjust that on your phones also. So you don't need to wear that particular eyewear. I hope your question is answered. Okay. Now I'm going to talk about poor vision habits. Okay, so I'm going to start off by saying that since we were children, how people used to teach us how to walk, how to talk, how to behave. No one has ever taught us how to see. Okay, so if you think about it, you just happen to start seeing. But how to see correctly and how I can protect my eyesight in the longer run, no one has ever taught us that. Okay, so this is what I'm going to talk about in this particular slide. Is there are certain very poor vision habits that we follow and becomes a part of our lifestyle, and we tend to continue doing that without even knowing that what we're doing is wrong. Okay, so eye strain is one of the major things because of which nowadays people have started getting cataract at the age of 35-40, which people used to get after 60. Okay, obviously with age your eye muscles start to weaken, but if you can keep your eye muscles flexible and strong and strengthen them, they will really be there. Like, they will be active, and they will work for you. They will help you see better even after you're 50 or 60. One of our senior doctors who is here, Dr. Krishan Kumar Goyal, who works here, he is one of the founders of Sanjeevan. He's 67 years old and he doesn't wear a pair of glasses. Or no glasses, no problem at all. It's only because of his vision habits that he has maintained his eyesight. Okay, so it is definitely possible. We've heard of a lot of stories. We've had a lot of patients also who have followed these habits, and today they, people who are on the verge of becoming blind can actually walk on the road on their own without any kind of dependency. Okay, so poor vision habits is something that we need to reduce in order to maintain a healthy eyesight. So what are the reasons for poor vision habits? Number one, prolonged wearing of contact lenses. Okay, anyone who wears contact lenses from morning to night, they don't understand that they're putting plastic on their lens. Okay, so plastic is basically stopping that oxygen to go to the eye. Okay, it's basically not protecting your eyes. It's probably protecting from dust, but the major function of your eye is to work properly. So that particular piece of plastic is not allowing oxygen to go into your eyes. Okay, so because of that, you tend to get a lot of issues in the future. You tend to get a higher number. Your number also tends to increase because of that. Okay, so if you go to an optometrist and he tells you that, okay, I have a number of say 0.25, okay, you have to start wearing glasses now, from now onwards. You start getting worried and, oh my God, I've got glasses now, I have to start wearing it. Otherwise, my number will increase. But you don't realize it's a vicious cycle. The minute you start wearing glasses, they're never going to come off. With age, your number keeps on increasing. But you can easily control that if you don't wear glasses, and just make sure that you're following good vision habits, which I'm going to tell you in the next few slides. Okay, poor posture is also a part directly connected to poor vision habits. Not getting regular eye exams. Basically, you need to know how, if you start feeling any kind of discomfort in your eye, don't be scared to visit an eye doctor or an ophthalmologist, okay? Because they will know, they will get your tests done and they will tell you the exact current scenario of your eye, like how your eyes are actually today. So you need to be aware of that. Just how people are scared of visiting dentists, people are very scared of visiting eye doctors also for some reason. But it's good to go to a good eye doctor and get to know your current eye condition. Okay, insufficient sleep is the next point, which is very, very important, because your body actually heals when you are sleeping. Okay, so it's very, very important that you sleep well, and sound sleep. At least 6 to 8 hours of sleep every night is important, so that you are fresh next day and your eyes are also refreshed. Another poor vision habit is continuously staring at digital devices. I will give you tips on how you can continue working at the same time not strain your eyes. Yes, that is possible. Okay, improper lighting. The worst lighting that you can watch your screen is darkness. Okay, because when, for example, you want to sleep but you're on your phone, most of us before sleeping, in order to relax your mind, you tend to be on your phone. But that is the worst habit you can do for your eyes, because your brain gets a message with the light that is emitted that I want to stay awake. On the other hand, your body is feeling tired. So there is no sync, there is no balance in your mental and physical being, if you understand what I mean. So it's very important that you keep your phone aside at least an hour before you sleep, so that your mind is relaxed and you can sleep well. Okay, insufficient water intake. Water, I'm sure all of you all already know, it's very, very important in order to hydrate yourself. Similarly, it's important to hydrate your eyes also. Smoking and drinking alcohol, which I have not mentioned here, is also one of it. Excessive smoking especially, because smoking is not good for anything. Not only for your eyes, it's not good for any part of your body. Does watching movie in movie theater when it's dark counts as a bad vision habit? No. See, movie is something, obviously it's dark, but it's in a big screen. Okay, you're not straining your eyes. You don't have to squint to see properly. Okay, but movie is a huge screen, and your vision still is moving. Your eyesight is still moving. You're not continuously looking at one person. You're looking left, you're looking at this person, that person, you're looking at the scenery. So watching a movie is still better if you compare it with using a mobile phone, I would say. Can we use night light apps on phone to read before going to bed? Night light apps. Basically, the thing is the phone. Okay, just you don't have to, if you're reading a book, but even when you're reading a book, the lighting needs to be pretty good. It has to be quite, like not too much also that it's coming on your head like spotlight, but it has to be pretty adequate, so that you can you're able to see properly. You don't have to do any kind of effort to see. You should be able to see naturally. That's what I would suggest. Yeah, night mode in phones, but again, don't do it in darkness. Okay, you can use night mode in phones, that's not a problem, but don't do it in darkness, I would say. Okay, so I'm going to explain you a few of the most common eye problems that people face, how it starts and how it could actually end up to if you don't take care of your eyes. Okay, so can anyone just tell me what this image, like what do you understand by this? Specs are a disability, dependency. Yes, that's right. Okay, so there is nothing wrong in wearing specs. Okay, if you have an elongated eyeball or a short eyeball, in order to correct that so that your light intersects at the retina, people tend to wear specs so that they can see properly. But what happens is, if you wear specs all the time, your eye stops functioning normally. Your actual lens is not working properly. Only the lens of your specs starts working. So your flexibility eventually starts becoming very, very, very less. Okay, hope that's making sense. Okay, this is just common sense. Just try and use your brain. Don't listen to what the optometrist is telling you or anything like that. Just try and think. If you wear glasses all the time, for example, if I'm walking with crutches every day, even if I'm able to walk, okay, if I'm walking with crutches every day, obviously my leg will start feeling weak on its own because I'm not making use of my leg. The use of my leg is to walk, to run, to jog, but I'm not doing that. For that, I'm using an external aid. Okay, similar concept is applicable for your eyes also. Okay, you should wear your glasses only when it's needed. So most of us have myopia or hypermetropia, that is near vision problems or distance vision problems. For that, we use glasses for both the issues. Okay, I'll explain that to you. Okay, so most people tend to get glasses. You go to a doctor and he'll tell you that okay, आपको myopia है and you will need to wear glasses from now onwards. Your near vision is good, but your distance vision is not clear. It's not good. So you've got a number, and now you have to start wearing glasses. So you listen to the person, you start wearing glasses. One very big mistake that you make is when your near vision is good, you are still wearing glasses. Why? For your near vision, you can actually keep your glasses aside and you can work. Okay, only when you're not able to see the distance, wear your glasses. Okay, but because we wear our glasses all day, you get used to it. Okay, or probably there's this kind of fear in you that you have to wear your glasses now. That has been probably your parents or anybody must have told you that. So you don't realize that okay, fine, I don't really need to wear my glasses in the near vision. For in cases of hypermetropia or hyperopia, it's the opposite. Okay, your distance vision is very good, but your near vision is affected. So the optician will give you glasses they're wearing glasses for both the cases, for near also and for distance. So here what happens is there is no basically flexibility, that your eyes are not able to work only. Okay, your muscles are not able to stay strong because you're not allowing it to, because of an artificial lens. Same concept is for contact lenses also, but glasses are still better than contact lenses because at least you have an option of removing them. Okay, but contact lenses, they are there on your lens from morning till night. Okay, another problem is astigmatism, where people actually have a problem in distance vision also and near vision also. So they have basically multiple focal points. Okay, so because of that, they have to wear glasses for both the problems. Okay, presbyopia is like reading glasses. People say ki I've become 40 now, I'm going to get reading glasses, or your near vision becomes affected. You start seeing your phones like this. You must have noticed many people who are above the age of 40, they try and squint to see. So this is basically called as presbyopia, and this also can be avoided if your vision habits are good and if you're actually taking care of your eyes. Okay, in the future, people, like, these are all the common eye problems people face. Okay, just jotted down a few of them. Cataract is one of them. Most of us must have heard of this term cataract, where your vision becomes very blurry. It's like basically a dirty window. Okay, you're seeing something through a dirty window. That's how it becomes. And there are different stages of cataract: stage 1, stage 2, stage 3. You can actually reverse, if you even detected with cataract, you can reverse cataract with certain vision therapies and certain eye exercises that we make people do here at Sanjeevan without any surgery. Glaucoma is also another all these problems you must have heard of. Glaucoma is another eye problem that most people face after a certain age. This is where the pressure in your eyeball is too high, and that is the reason why you have this problem. It's all related to blood pressure. So that's a very, very serious problem, which eventually can lead to blindness also. Another problem is diabetic retinopathy. As the name suggests, diabetic retinopathy. People who have diabetes, and if they do not control their diabetes, and they don't take care of their blood glucose levels, what happens is there are abnormal blood vessels that start to form in your eyes, especially in the retina, which I explained to you in the beginning. When they start to leak, okay, this is how patchy your vision becomes. Okay, and eventually when the blood vessels are too many, your vision can totally be obstructed. Okay, so this is a very, very serious problem, and there is no treatment in allopathy for this particular problem. However, with integrative medicine and with integrative ways, you can try and reverse it or at least maintain your current vision. Okay, so anybody who has diabetes, make sure that at least once in 6 months you are visiting an eye doctor and knowing your current vision and current status of your eyes. Very, very important point. Okay, this is another serious problem that people face. This is mostly genetic, but due to basically visual habits or due to not being detected at an early age, people come to know about this problem at a very later stage. It's called as macular degeneration. And there's another type which is age-related macular degeneration. Here, as you can see this image, your central vision is getting affected. Okay, so center, that basically you will not be able to focus on a particular object. However, your peripheral vision remains intact, but your central vision gets affected. Central vision is basically your macula that is responsible for central vision that gets affected. It starts getting degenerated. So this is also a very, very serious problem. People can become blind also with this problem. Like this, there are many other such retinal disorders and serious problems that people are not able to detect early. But this, I don't mean to scare you or anything like that, but it's just important to have the knowledge of these things and to know, because our lifestyle for our eyesight especially is very, very, I can say very stiff, very sedentary these days. So it's good to know how your current vision is. Can macular degeneration be cured in elderly people? I see cure is a very, very big word, okay, but it can definitely be treated. Like I said, in allopathy, there is no treatment for this particular problem. However, if his vision is say 60% intact, we can stop it to that level. We'll not let it deteriorate further. So for that little thing is also a very big thing for the person who's actually suffering from the problem. Okay, so we can do that, and eventually we can reverse it with vision therapy and other non-invasive procedures that we do here. Can minuses not be reduced? Yes, absolutely. See, this number that keeps on increasing, for many people is genetic also. Okay, when your parents had it and even you have it now, but it's not necessary that if your parents had that higher number that you have to live with that higher number. Okay, so you can eventually reduce it. I will give you tips and I will suggest things. You can take a pen and a paper and you can note down these tips, and these tips will really, really be helpful to you, provided you follow them. So total eye health. Okay, so this is connected with computers also. Total eye health at the computer, total eye health when you're working on your desktop, total eye health when you're on your mobile phones, total eye health in general. Okay, number one is don't stare. Okay, all of us have a very bad habit of staring. You feel that if you stare at something, you'll be able to focus better. But this is wrong in many ways. When your eyes, especially your eyeball, when your pupil is moving when you're reading something, your focus becomes better because your eyes, when they're moving, they will be more healthy. I'll give you an example. Okay, there are two types of water bodies. Okay, one is a stagnant river and one is a flowing ocean. So you tell me which insects will be more attracted towards the flowing ocean or the stagnant river. Obviously, it will be the stagnant river, right? Because whenever you are stagnant, you are inviting problems for yourself. Anything, forget eyes. If I keep my hands like this for like 2 hours, 3 hours, if it's just like this, obviously it will start giving me pain. It'll give me a sign that please keep me down, my hands are paining. Okay. Similarly, when we stare at the screen for too long, listen to your eyes. You will come to know when they're actually starting to strain. Immediately when you come to know they're starting to strain, look far away. Okay. Change your direction of your vision. Okay, very, very important tip this is. When you're continuously staring at the screen, you will get a message from your eyes in some or the other form. All these symptoms are signs that your eyes are giving you to basically follow good vision habits. Okay, so don't ignore them, I would say. You have to listen to what your eyes are telling you, and just if you feel like the strain is there, maybe after 15 minutes, after 20 minutes, look somewhere far away and come back to the screen. Okay, don't think that you're wasting your time while doing that, but that is ensuring that your vision is good and you're basically protecting your eyes from eye strain. Okay, I hope this makes sense. This tip is very, very important to follow because this will ensure flexibility. Okay, so what happens is when you're looking near, then you're looking far, you're coming back close, looking far, flexibility. Your eyes is flexible, it's not going to get strained. Okay, next is keep blinking. Blinking, there's a reason why we blink. Okay, there's a reason why we have an eyelid. Okay, it's because so that our moisture is intact in your eyes. Okay, so when you're staring, you forget blinking. When you're watching something, when you're doing some work, we don't tend to blink. So when you're talking to somebody, you'll notice that you blink much more. Have you ever seen anybody staring into that person and talking? No, right? Because it's natural body's way of talking. That's how you talk. So similarly, think of your computer or your laptop as a person, and that's how you read it, or that's how you see it, or that's how you watch something. Okay, so make sure you're blinking. Initially it will be difficult, but eventually it will become a part of your lifestyle. Okay, so whenever you're looking at or reading, say, a document or reading an agreement or whatever it is, make sure that you're blinking. Look at commas, look at full stops, look at exclamation marks, and blink that time. Okay, so these are like reminders. Keep reminding yourself to do these things. So blinking is very, very important. Number 3 is the 10-10-10 rule. You must have heard of 20-20-20 rule. Okay, so there is no hard and fast rule that you have to follow. Basically, you just have to listen. If you feel like, okay, fine, your eyes are starting to strain now, every 10 minutes, for example, look at least 10 feet away at some particular object for 10 seconds. If you have a window, well and good, look, you can look really far away. If there is no window around you, okay, look at any particular object that you can look at. Basically, you have to have a shifting process. This is called near-far shifting, okay, which is extremely important. Okay, and you should, if you have children, try and explain this to them also if they can follow it. Okay, so 10-10-10 rule. Every 10 minutes, look at something for 10 seconds, at least 10 feet away. Okay. Now, coming to posture, okay, very important that your feet are firm on the ground, okay, so that your blood circulation is not obstructed. Very, very important. Your back needs to be straight, okay, don't slouch like this, not good at all for your shoulders or for your lower back, okay. Make sure your back is straight, okay. When you're using your fingers for typing or anything like that, make sure that you keep stretching them, this kind of stretch. Very, very important. Okay, very good, very important for your fingertips also, because for our phones, for our keyboards, our fingers are always working like this. Okay, also our wrist most of the time is like this, so wrist also starts to pain. Many people must have experienced, so keep rotating your wrists clockwise, anti-clockwise. Okay, so these things are very important. Also, the distance that you have to maintain from your screen to your eyes can be different for each person. It varies from person to person. There is no rule that it has to be 25 inches or 10 inches or 15 inches. Okay, if I feel like this distance is good for me and I'm comfortable, it's good. If I feel like sitting here is good for me, I will work comfortably, is good. Basically, it has to be a comfortable distance. Don't try and be too far or don't try and be too close also, but it should be comfortable for you. Okay, so make sure that the distance is very comfortable. You don't have to squint to see anything. Okay, even for your phones, don't keep it too close because your eyes tend to squint when you keep something too close. So make sure you're not making that mistake. Then tip number 5 is take a break. Taking a break is very important from your regular work, and taking a break does not mean be on your phones. Okay, that's very important because again, you're not giving your eyes the break that they deserve. Just take a break for every 2 hours. You can take a break for every 5 or 10 minutes, which is very, very good for you to come back and be productive. Okay. Palming is one exercise that we make our patients also do here. If you have not slept properly the previous night, or if you have had the weekend and you sit awake till late nights, and next day Monday morning you have to show up to work and you haven't slept properly, you're getting headaches, you're hungover or whatever it is, okay, palming is something that will ensure that you are instantly refreshed. Basically, it's very simple. You just have to rub your palms, make sure they are warm, and place it gently over your eyelids. Make a cup, okay, gently over your eyelids, and just sit like this for 5 to 10 minutes, okay. Very, very good. Like basically just 5 minutes of palming is as good as 1 hour of sleep. It's that effective, okay, and it gives you instant relaxation, okay. It's like meditation for your eyes, okay. It's very, very good. So you can do this. It's called palming, and you can do this even when you're in the office, when you're at home, whatever you want to do. If you're stressed, you can do this for that as well. It's very important, okay. Then just digital detox is important. Can't be on the screen all the time. Make sure that your screen time, if you're having 6 to 7 hours of screen time in a day, make sure that you're at least having little, maybe half an hour or 1 hour of green time also. Being outdoors is very important these days. I cannot stress enough on how important it is, especially for vitamin D, for the oxygen that the plants and trees give us, the fresh air that we breathe when we're around in such environments. It's very, very important for your mental health and mental relaxation also. There's some kind of calmness that we get when you are in such parks or anywhere outdoors, or if you're playing an outdoor sport also. Make sure that you enroll yourself or your child in any kind of sport. It can be badminton, it can be football, cricket, whatever it is, okay. Even if it's an indoor sport, it's okay, but it's like a recreational activity which is very important, which has to be balanced with your work as well. I've said it before also, have regular eye tests. It's important to know your current vision, and that's how you can act upon it, and you can take steps in the future on how you should take care of your eyes. Don't be scared to visit eye doctors. Coming towards the end, nutrition for eyes, okay. Just how there are certain foods that are important for digestion, for your other parts of the body. Calcium is required, vitamin A is required, iron is required. Similarly, there are certain foods that are very, very crucial for your cells in your eyes to function properly and normally. Okay, so you can make a note of these things. Vitamin C is one thing, vitamin B is one thing, vitamin A is one thing, beta carotene is one thing. So with a lot of foods, we get these nutrients also. Until and unless you are really, really lacking it, only then you require supplementation. But you can get yourself tested, or even if you don't get yourself tested, it's just about having a healthy lifestyle. This will promote good eye health also, and at the same time keep your overall body healthy. Okay, so antioxidants are found in berries. You can have strawberries, blueberries, you can have raspberries. All types of berries have antioxidants. Zeaxanthin is available in all your greens that you have: spinach, methi, kale, whatever greens are available here in Bombay. Local foods, fresh foods, seasonal foods are the best because they are more fresh. You can consume them. Carrots, most of us have heard that are good for eyes, but there are many other foods also that are very good for the eyes. Okay, so this is a list of antioxidants which is very important to consume on regular basis, and these are the properties that they have. If you want, you can take a picture of this. Like vitamin E is extremely important. Vitamin E along with vitamin D is another vitamin that is underrated and not given much importance. Even doctors don't tell you to get this test done. Very, very crucial test for your brain cells, for your nerve cells, for all these cells to function properly. Make sure that your vitamin E is at par and it's basically in the range. Okay, vitamin C comes with oranges, lemon, kiwi, grapes. All these fruits, all citrus fruits have vitamin C. Beta carotene, you can get it in carrots, spinach, sweet potatoes, any green leafy vegetables has beta carotene. Glutathione again is a very important antioxidant. Many doctors use this for skin treatment also, and we have seen excellent result with glutathione consumption for our eye patients as well. Lutein and zeaxanthin again very, very important, and omega-3 fatty acids is good for cholesterol also, plus to maintain your cells in your eyes. Okay. Now, last but not the least, use lubricating eye drops. Most of us use eye drops, but what is it that we need to see when you buy an eye drop? Or even if a doctor is recommending, until and unless a doctor is recommending an eye drop to you, do not go to a medical store and buy it on your own. Okay, that is one thing. If you have to go and buy an eye drop, what is it that you have to look for in the eye drop? Number one, it must be made with natural ingredients. That is, then there has to be no chemicals in it, no steroids in it, must be natural, must be easy to use, must be gentle and cooling to the eyes, no kind of side effects, no redness or anything like that, and should cause instant relief. Okay, just how Riddhi told that I have been a part of the research and development of this particular eye drop called Pure Vision, and we have developed a natural formula mainly for all those people who are trying to combat digital eye strain, dry eyes, and any kind of itchiness or redness that they face in their eyes. This has aloe vera, it's got rose, it's got neem, it's got chandan. All the ingredients are natural, which will help in soothing the eyes, basically. Okay, so if you are someone who experiences dry eyes regularly, you can use these eye drops. I'm sure they'll be helpful. You can use them up to 2 to 3 times a day, and they are available on Flipkart. You can get them if you wish to. I will request Riddhi to share the link. So if any of you are interested in buying this eye drop, you can purchase them. Okay, so the bottom line of this presentation is to live well, you have to see well. Only if you can see and perceive things will we be able to live a satisfied and happy life. And productivity wise, even at your work or even in your personal life, it obviously good eye health ensures better quality of life. Okay, and make sure that do not leave your eye problems for the last minute. Make sure that if you have a problem, get it diagnosed and start the treatment for it immediately. Thank you, everyone. I will answer your questions now. I hope this session has been informative. And if you have any doubts, we are always there. You can email me or you can ask me questions. Is there an online treatment for reducing myopia in your clinic? Because I want to join. Yes, you can definitely. I will give my details to ensure my team, and you can get in touch with us. We have online treatment here. It's possible, and you can definitely get in touch with us, and you can take our consultation from our doctors. In case of eye pain, can we wash out with tap water? Tap water is fine. Tap water is fine. Make sure that it's just fresh and it's clean. Tap water is totally fine, not a problem at all. What about Drishti eye drop from? See, I honestly don't know about other eye drops, but I have been a part of the R&D team in this particular formula, and it's very, very effective. You can definitely try that eye drop. I'm sure it'll be good, I don't think there should be any problem unless and until it's following the criteria that I mentioned. No steroids, no chemicals, no harmful preservatives. Is laser safe? Laser surgery is basically for time being, you'll be very happy that okay, fine, I'm rid of my glasses now. But eventually what happens is your flexibility reduces to a great extent. So eventually after the age of 30 or 40, whenever, in the next, at least a decade from the time you get your LASIK surgery done, you may get reading glasses. So honestly, there is no point. And mostly whenever you go to a LASIK doctor, he will always be wearing glasses. Notice that. I have no vision in one of my eye. Can I continue working on computer like proper office job? Shweta, for this particular problem, I'll have to know what the reason is for not having having vision in one of your eye. We'll have to perform a couple of tests to see what problem are you diagnosed with. In the meanwhile, you can definitely continue working on the computer if you're comfortable doing it, okay, and you're not straining your eyes. So if you can do that, you can continue working on the computer, but do get yourself diagnosed and know what the problem is so that you can find a solution.
Thank you so much, Abhishree, for this wonderful and informative session. It was definitely very, very informative, and I really had, a lot to gain out of this session. There were a lot of things that we take for granted, our eyes especially. So yes, thank you so much for joining us today, and thank you all to all our participants and attendees who've taken out the time to attend this sessions. Look forward to seeing you to our other sessions as well. Thank you very much.
Thank you so much.